It is my honor and privilege to welcome you to this auspicious event of the national launch of the Primary Healthcare Leadership Campaign, an innovative project to improve and revitalize the PHC system and services in Nigeria by fostering healthy competition among the 36 states of Nigeria and the FCT that will hopefully stimulate care delivery for the well-being of Nigerian people, especially the over 70% of our population who access or are to access health services at primary healthcare levels. Your attendance at this epic event is a measure of your commitment to national duty and determination to support improving primary health care in the healthcare system. The initiative is born of the unhappy observation that despite increased attention to strengthening our PHC system over the last 2 decades, the sector has not thrived. The primary healthcare sector has not thrived everywhere, and Nigeria continues to record poor outcomes in reproductive, maternal, neonatal, child, and adolescent health and nutrition. Though there has been minor improvement in the past few years also, more effort and investments are needed to strengthen the primary healthcare system. It is on this basis that the Aliko Dangote Foundation, Bill and Melinda Gates Foundation, Federal Ministry of Health, National Primary Healthcare Development Agency, UNICEF, and last but not the least, the Nigeria Governors Forum held a 2-day roundtable meeting in Seattle, Washington in November 2019 and reached a consensus termed the Seattle Declaration, which reaffirmed the commitment of the 36 state governors to prioritize PHC strengthening by operationalizing primary health care under one roof. Basic Healthcare Provision Fund and the Abuja Declaration as vehicles for entertaining, or rather vehicles for attainment of universal health coverage and the Sustainable Development Goals for economic growth. The Primary Healthcare Under One Roof is an initiative of NPHCDA which started in 2011 and aims to strengthen PHCs through 9 pillars that have already been mentioned: governance and ownership, legislation, minimum service package, repositioning systems development, operational guidelines, human resource for health, funding sources and structures, and then of course the office. Even though many states have begun implementing the initiative, much remains to be done, especially in the pillars of minimum service package, repositioning the structure, and human resource for health, where there is shortage of trained staff at PHC level. The Abuja commitment is an agreement by heads of states of the African Union in April 2002 to dedicate at least 15% of annual budget to the health sector. Since then, neither the federal nor any of the component states of our federation has actually been able to meet this target, except, I believe, 1 or 2. And it's therefore our hope that operationalization of a renewed commitment in the Seattle Declaration and the PHC Challenge Fund will help improve the government, the state government's attention, will help to drive the state government attention to primary health care and health in general. And I must say that attention to primary health care at this moment is a lot more urgent than to tertiary health care. which the federal government takes care of in its own way. This is one of the key objectives of the Primary Healthcare Summit, which was organized by MPA-CDA in March this year. I commend MPA-CDA and our partners for the concerted effort to sustain the improvement in PHCs in Nigeria by unlocking both public and private resources for PHC system strengthening. For its part, the federal government is developing and directing resources from Global Fund to cover the country with oxygen sufficiency by building oxygen plants, of which we plan to have at least 100 or 120. Some of these will have to be settled in state government hospitals, and we shall be signing a compact with state governors to have viable addresses of viable general hospitals where these oxygen plants will be stationed and maintained and operated. The purpose is to be able to supply oxygen to all parts of the country. It's a lesson we learned from COVID-19, but which is extremely useful in all other cases, in managing pneumonia, asthma, and even in performing minor operations, so that primary healthcare centers, private hospitals, and all who require oxygen can have oxygen. And in that connection, we are also accessing over 30,000 oxygen cylinders through the Global Fund facility to make it possible for health facilities to not travel too far before they get oxygen. I must say also that UNICEF has been particularly involved in this, in their Every Breath Counts initiative, which is met also by this new supply of plants by Global Fund. So the Primary Healthcare Leadership Challenge is a partnership of the Nigeria Governors Forum, MPA-CDA, UNICEF, and BMGF to catalyze implementation of the Seattle Declaration by states. There will be periodic measure of progress against selected indicators based on agreed performance monitoring frameworks to be computed annually, and a monetary reward given to best performing and winning states, who will also receive non-financial rewards from the Minister of Health, the Aliko Dangote Foundation, and Bill Gates. The fund will be administered jointly by NPA-CDA, UNICEF, and NGF. A steering committee and technical committee will ensure seamless operationalization of the Challenge Fund. The federal government, through the Federal Ministry of Health, is committed to creating an enabling environment for the success of this innovative initiative. I will ensure that necessary policies and guidelines to facilitate the process are in place, and that essential drugs, vaccines, and consumables to drive it are adequate and made available in a timely manner. We will endeavor to source required funding to support this project. The Federal Ministry of Health has disbursed 100% of the 2021 BHCPF to all states and is making concerted plans to begin disbursement of funding for 2022. I call on states to fulfill requirements to access the fund, while reminding governors and respected governors that the Basic Healthcare Provision Fund alone is not enough to drive the PHC system in all states. It requires funding from other sources. And I also urge you, therefore, to continue to budget and release at least 15% of the total budget to be used for primary healthcare services. The federal government will also strive to operationalize policies to improve quantity and quality of human resources for health. And so I call on our esteemed governors to leverage the health workforce available in tertiary and secondary health facilities to support and improve the human resource for health at your state, at PhD level, and also at other levels. I might at this point also mention that the Ministry of Health is working on creating an integrated medical emergency operations center for all states. It's a standing integrated medical emergency operations center to take care of both public health and ordinary clinical emergencies, and will be open 24/7 under the leadership and headship of the state government. Finally, I wish to thank the state governors for this wonderful cooperation we have had in strengthening the health system in our country. I again recognize and thank our very staunch partners, the Dangote Foundation and the Bill and Melinda Gates Foundation and UNICEF, for always helping us to emphasize the value, the importance, and the urgency of beginning to build a healthcare system from its foundation. And that foundation needs to be strong, and it is a primary healthcare system. All others rest on that. In addition, I have already mentioned before that the Ministry of Health is working on supporting states to strengthen the secondary level care, one general hospital in every state, where specialists will be deployed from the teaching hospital or federal medical center in your state to come to the general hospital level, provided there are facilities for boarding, that's to say quarters, and perhaps a little stipend. Their salary is already taken care of at federal level, to bring expertise nearer to the people so that the journey and the crowding at federal medical centers and tertiary institutions is reduced, and we create a better functional health system with fully functional primary healthcare system, with the CHIP system that connects to the grassroots, the secondary healthcare system that's strengthened with support of consultants and specialists from the university level, and then, of course, the tertiary level and the specialty level. And again, I want to mention to those who do not, maybe those who have not heard, that His Excellency the President has approved 3 more federal national orthopedic hospitals, in one per geopolitical zone. The Northeast has one, the North Central has one, and the South-South had one in Benin, Jos, and Jalingo, respectively. I conclude by assuring all here present, Your Excellencies, that the Federal Ministry of Health will do the needful to sustain Primary Healthcare Leadership Challenge Fund, and in order to strengthen and continue to improve services and make health services available to all Nigerians. I again welcome you and thank you most sincerely for your attention.